We can also talk about attendant-borne diseases. So attendants would be individuals that work in clinics and attend to patients. So like vector-borne and waterborne pathogens, pathogens acquired while in the hospital can be transmitted from immobile hosts. In this case, the transporting is done on the hands of doctors, nurses, and other attendants and the objects that they touch. Such attendant-borne transmission is the major route for most serious hospital-acquired pathogens such as Staphylococci, Streptococci, Enterococci, Pseudomonas, and Clostridium difficile. Attendants usually do not get infected, partly because they are less vulnerable than their patients. They wash their hands before leaving the environment, and they have generated some immunity to the hospital organisms. But they certainly, particularly if hand washing is not practiced between interacting with different patients, they certainly have the potential to transmit parasites between patients. And so this is another one of my figures that I drew up way back in 1995. So for some pathogens, the sicker you are, the more likely transmission will occur. And so what we have here is a healthcare worker that's paying more attention to the more sick individual, which again harks back to the ideas of childbirth fever being more easily transmitted if a woman dies in the hospital. Certainly dying, an individual that has died is a sick patient, and they had more attention from the physicians who then autopsied them than they would have had if in fact they had not died. And so this healthcare worker is attending the sicker patient more than this more robust patient here on the right. And all over those little dots are little bacteria that he or she has picked up on their hand. By the way, this was drawn with the Windows Paint program way back when. That was the level of technology I had available to me when I first started teaching at OSU.